So this is an entire ovary. This is quite a beautiful but tragic image. So on the right, the white circles are follicles. That's where the eggs actually grow and are ready to be released. But then in the middle of this image is a whole load of cancer. So this image is from, a whole ovary. It's about an inch wide and an inch high. And it's been blown up really, really large, and we can learn a lot about this cancer from it. So why do we care in the first place that we can do this with AI? So in histopathology at the minute, in the UK, over 90% of our pathology departments cannot meet demand. So we have our departments outsourcing work, we've got them bringing in temporary staff, they just do not have the staff to do the work they need to do. And it's really important because a number of weeks delay in a cancer diagnosis is known to be important to the survival of the patient. Most countries are in an even worse position than the UK is, so this really is a global problem. So if you can see on that map, the UK is actually one of the best supplied countries for pathologists, and yet we're struggling that badly. Ovarian cancer is a particularly difficult cancer, so the pathologists achieve maybe 75 to 90% accuracy at subtyping. Not great. A lot of the time they need to get a second opinion, which is costly, it takes longer. The prognosis is probably missing some really important information that we can learn through AI, because at the minute the prognosis is not very precise and it just doesn't tell the patient or the clinician a lot about what's going to happen. Current AI research is limited in this field, so we did a systematic review. We found there were only 45 studies in our field, whereas in breast cancer there's over 500 and actually probably more like over 1,000, but no one has really brought that together in a succinct way. And all the research that's been done is sort of small data sets, it's prototypes, people are playing around with data but they're not quite ready to make that step to the clinic yet. And a few of the recent studies are getting there, so actually here in Vancouver there's a group doing really great work, but it's just not ready yet. So the research we're doing, we're collecting a much bigger data set than the other people have had, so we're collecting thousands of slides from hundreds of patients, which these other groups have not had access to, and we're hoping to make that available to other groups as well. We're focused on the subtypes and on the overall survival prognosis, so these are both really important in helping the patients have more information, helping the clinicians know what sort of treatments to deliver. And we're building these methods on attention-based multiple instance learning for whole slide classification, which is something you'll hear about a lot if you just go to any pathology talks. It's very sort of common in the area at the moment, but we're focusing on both using transformers and graphs together to see if we can improve performance. And we're focused on robust validation and computational efficiency, because these are the things we think are lacking in the field and that will bring better clinical care.